Education conducted on Friday, August 7th at noon. This meeting is being conducted by teleconference. And I guess I have not had a chance to see if all board members are present. Are we missing anyone today?
All board members are present.
Okay, all board members are present.
Tina, have you seen Tiffany? Is she on?
I'm sorry, no, Tiffany is not on.
Okay, with the exception of Member Bernard. Okay, with that, if you would just please keep your microphones muted and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Have we received any public comment, Tina?
No public comments.
Okay. With that, we will move right into our agenda item, and I will introduce our superintendent, Darren Vanderheiden.
Thank you, Keith. The purpose of this meeting is to kind of give you an update and an overview on where we're at with our COVID-19 planning. We're going to discuss the three models and kind of how those models are determined and some of our preliminary plans. We're also hoping to have a little bit of time for discussion and answer any questions you may have. And you'll have a little bit of time now to digest this information. And then on Monday, we'll have some additional conversation about it. So the three areas that we're going to cover, we're going to talk a little bit about the parent survey results, the Minnesota Department of Education and the Minnesota Department of Health learning models, and then again, some Q&A time. So jumping right into the results, we had a very, very good return from our parents and our families on the survey that they completed. So we asked parents what their intention was coming into this next school year, and if they intended on coming back in person, if that was the decision, if they would select distance learning, and these are the results. So we had 52 individual students suggest that they would be leaving Hutchinson Public Schools for a different option. We had 305 students suggest they would like to request distance learning, and that's a K-12 number. 2,266 students chose in person, which is right around 90% of our total population. So 2,623 students or families completed the survey, which means we still have a couple hundred out there that haven't completed it yet. I know we're still taking some of those families' calls. They hadn't made a decision yet, or they haven't been able to complete it. I'm going to stop right there and just, do you have any questions on the survey itself?
Hey, Darren, this is Brian. Quick question about the choice to enroll in other options. Any insight into what those other options are or where those students are going?
Yeah, we are just cleaning and filtering that data now, so I don't have a detailed answer for you at this time. Some of those folks might just be moving from the community. Some of them might have selected homeschooling or another option here in Hutchinson. I just don't have those details at this time. It's a good question, though. Other questions about the survey itself? I know we had received a number of phone calls and a number of emails on getting the survey out there right away, but then kind of having a short window to complete the survey. But we really needed to do that based on the time frame we have between now and when school starts. So we really do appreciate the parents completing it as quickly as they did. And we've also assured them that if they do change their mind between now and when school starts, we'll certainly accommodate them. So if there's no other questions, we'll go on to the next slide. So this is what it looks like by grade level. So early childhood family education, all 10 of those individuals suggested they wanted to come back in person. Preschool, we did have one preschool family that said they would prefer distance learning to in-person. So out of the 53, 52 said in-person and one said distance learning. In kindergarten, we had 4 that enrolled somewhere else other than Hutchinson Public Schools. 12 have asked for distance learning, and 143 have asked for in-person learning in our schools. Grade 1, it's 2 enrolled elsewhere, 20 in distance learning, and 156 in person. Here are the next 4 grade levels. This would be Park Elementary. This is 2nd through 5th grade, and you can take a look at those numbers. Again, pretty consistent from 17 to 27 choosing distance learning and the rest choosing in person. Here's the middle school numbers. We did have a few that enrolled in other places. And then 6th grade, it was 22 that wanted distance learning, 28 in 7th grade, 20 in 8th grade, and then you see the numbers for in-person. So a pretty high return on those families that want in-person learning there as well. Moving on to the high school, 9 through 12, you'll see that there was an uptick in the numbers here in grades 11 and 12 asking for distance learning. 9th and 10th grade are pretty consistent with the rest of our numbers. The other question that we asked was overall bus transportation and if they would opt in or out of transportation. And we're asking this question because that's one of our main concerns with bringing kids back into school is the density on our buses and the limited availability of drivers and buses. So we asked our families if they would be willing to opt out. And you can see at a very high rate, we had 1,128 students opt out of transportation, and we had 1,495 that suggested they still needed transportation. So the total number responding was 2623 on this. And I don't know, Brian, if you have additional information to add there.
I don't. We're working on the numbers right now, and we hope to get information out to the parents for what their preliminary bus routes will be by the end of next week. But I want to thank all the parents that actually did opt out. That reserves those bus seats for the kids that may not have any other option to get to school, and it allows us to socially distance those students the best that we can. So thank you for those that are able to transport their own students to school.
Yeah, absolutely. And I believe the 1,128 students that opted out, that includes our distance learning families that have chosen that as an option. Is that correct, Brian?
Yes, it's right in that ballpark. I just been working on that data right now, but it's really close to that number.
Okay. Questions on busing, transportation?
Hey, Darren. So if they are busing, would there be guidance as far as sitting with families, sitting together and things like that?
Yeah, we've got a social distancing plan for our transportation system. It would include some real basic things like we would load all of our buses from back to front, and we would also evacuate our buses in the same way or unload in the same way from front to back, so we don't have a lot of cross traffic going there. We would ask siblings to sit with one another, and we are going to have seating charts on our buses to make sure that we can control the flow of students on and off. Based on our opt-out, we're in a really good position there that we think we can do a really good job with the social distancing, and we're hoping that in most cases it will be the 6 foot that would be required also in hybrid learning. We'll know a little bit more once we clean and filter the data and apply it to our bus routes.
Thank you.
Anything else on busing that I didn't mention? Yeah.
Yeah. Are these student numbers or family numbers? So like the 26, 23, that's families or that's each student?
That's each student.
Okay.
So it's a little tricky because we ask parents to fill out the survey for each one of their children. Because they attend different schools, we really needed to drill down and ask each family to fill it out per student in their family or per child in their family.
Sure. Okay. Thanks.
Hey, Darren, getting back to the overall numbers, does that affect the section distribution at any of the schools that you're seeing at this point?
I don't think so. We're applying those numbers right now. And based on these numbers, I had mentioned even going into a hybrid, if we're split into an A-B where our population is split into 50%, we are certainly going to meet that standard. But we haven't completed all that work yet, but we feel good about it. Okay, Tina, I think we can move forward. This is an important slide because this is basically the way the Department of Ed and the Department of Health is suggesting how we're going to determine which model we're going to use. And not only which model we're going to use to start the year, but we're probably going to have to toggle between models throughout the year. What we know for sure is change is inevitable, and we are going to be making changes. And we're going to do the best we can to transition from one model to the next. So this is really just kind of a starting point for us. So the Department of Health has developed a formula based on local COVID data that they're going to use to give us a range or a number. And then that number would help guide us on which model of education we should start with and then use throughout the year. So the other thing that's important is the Department of Education and the Department of Health is going to be consulting with us whenever we develop a model that is within their ranges and also outside of their ranges. So as a district, if we decide to dial forward or backward within those models, they will be consulting with us. And ultimately, the Department of Health does have the ability to move us from one model to another. The third step is they talk about an incident command team. And in our structure right now, we've used building leadership teams and then a district team to make sure that we're covering all the requirements and we've got a plan in place to keep people safe within our building. So there's going to be more to come on that incident command team and how we're going to actually use them throughout the year. They don't have that clearly defined at this time. As I had mentioned before, we're going to be in consultation with the Department of Health in step 4 when we do move from one model to the other. And again, that'll be based on our local condition at that time. So as much as we would like to believe that it's entirely our decision, there's going to be other folks involved with that. I'm going to stop there and take any questions you have on this 5-step process.
This is Joellen. I have a question, and it might be more for Dr. Pullman, but based on the COVID numbers, I guess my question are the test availability locally, possibly a question about the cost and how quick the results are available.
So Joellen, I'm not sure I heard everything you just said. You kind of cut in and out. You were asking about testing availability and turnaround time for results?
Yes,
okay.
Yes.
So testing availability locally, I can speak to Hutchinson Health. Currently, are a little bit tight in our testing availability because of national shortages. We are able to perform testing locally, but we do prioritize that testing for the highest acuity patients, such as patients who are being admitted to the hospital or have acute symptoms. Generally, when they meet the criteria for local testing, that priority turnaround time is less than 24 hours. But depending again on what the supply is and what the priority, that could be within 24 hours, that could be 1 to 2 days, that could be up to 4 to 5 days, all depending on the priority and what the supply status looks like.
Thank you. The other part of my question is just, are board members going to be on the command team? Is that something that would be appropriate or not?
Yeah, that certainly could be appropriate. The incident command team, it sounds like something that you'd bring people together to deal with a crisis in the immediate, but that's not really the way they're describing it. It's going to be one of those teams that maybe is monitoring this thing as we go. And when there's changes, that team would provide feedback on the direction the district should go. So we're hoping to involve many stakeholders in this. And also, we don't want to forget our leadership teams at the building levels either. I think, have we lost Joellen?
Yeah, I do not see her on the call at this time.
Oh,
Okay. She's back.
All right. We thought we lost you for a second there, Joellen. Okay, Tina, I think we can go on to the next slide and we'll follow up if there's some additional questions there. So this is the formula that the Department of Health has established to determine the ranges and the local COVID numbers per county. So it's the total number of cases in the last 14 days divided by the county population over 10,000. So if you would take a look at our formula, that's basically the total number of cases over 14 days divided by 3.5. And then you're going to get a number, a range number from 0, and I think the higher standard is like 70. I've got a slide coming up. And then at the bottom of this slide, you'll see what our numbers have been over the last 28 days, starting 7/5 through 7/18, and then 7/12 through 7/25. You'll see McLeod County was 6.14, Meeker was 6.07, and Renville was 4.76 between the dates of 7/5 and 7/18. And then you'll see the latest data that came out yesterday, 7/12 to 7/25. Our numbers went down slightly. Meeker County stayed exactly the same. And then Renville County, there was an uptick there. But that's how they're doing the calculation. And it is something that we're monitoring. So any comments or questions on the actual calculation?
Darren, just a quick comment about data in Minnesota. They tend, as you say, the information tends to lag a little bit, and just for everyone's information, bring everyone else up to speed. In McLeod County, we've had approximately 20 new cases. Actually, I'm looking at the data now. Looks like more like 30 new cases in the last 7 to 8 days. So this number may change a little bit, but really to get to that number where we're above where we're 10 or above, we would need 35 to 40 cases in a 14-day window. No real clarity on where that spike is coming from over the last week. I can just speak to Hutchinson that we can only account for about half of those positive tests and not the full amount. So just know that the Minnesota Department of Health is involved and they're doing contact tracing, and again, that is being looked at.
Right. It's really just a snapshot in time of those 14 days, and it's hard to predict what's going to happen in the next 14 days as well. I think the important thing to remember on this is we really need to look at trends, and is it a general uptick over time? Was it just kind of just a 2-week period that we saw a blip? Those are the things that we're going to have to really monitor. And we're going to get this data, like say, every Thursday, and we'll have new numbers every Thursday to post and to take a look at and make decisions on. Any other questions on the formula itself? Okay. So this is what the Department of Health is recommending. And based on the formula, from 0 to 9, they are suggesting that you would have in-person learning for all students. Numbers 10 through 19 would be in-person learning for elementary students, but hybrid learning for secondary students. That would include middle school. And then 20 to 29, it would be hybrid for all students. 30 to 49 would be hybrid learning for elementary and distance learning for secondary. And then 50 plus cases in a 14-day period would be distance learning for all students. I will also add that the Department of Health is suggesting that we also may have to break this down by building as well. if there was an outbreak or if one building had some very different factors than another building, you may not do this consistently throughout. And I don't know how we would handle that in Hutchinson, but that is a potential possibility for us. So the way I'm understanding this is really just a starting point. So the Department of Health is saying, if you're within these ranges, this is what we recommend you do. They're not saying that you couldn't dial forward or backward, but if you did that, you would need their approval to do that as a school board. Questions on this table?
So Darren, each week we get an update on our case rate, and whatever the case rate is for that period, we would then perhaps move to a different model based on the results. So this could change week to week?
Potentially it could, and I think it kind of depends on what those numbers look like. If you're borderline between one learning model and another, you may stay with that same learning model for another 2-week period to kind of see how it plays out. Again, looking at those trends. So I would like to tell you that it's going to be an objective decision each week, but I don't feel like it'll turn out to be that. Again, especially with those borderline numbers, if we had a number of 10 or 11, would we automatically switch gears that next week? I don't think the Department of Health would say that would be wise. Let's wait and look at one more week's worth of data and make a decision at that time. Does that make sense?
This is Tiffany. I have a follow-up on that question. If we do change models, or when we change models, what is the length of time for notification when we switch? Meaning, like, what's our, like, do we have 24 hours or do we have the weekend, or what does that look like?
Yeah, according to the guidance, and you have to understand we have hundreds of pages of guidance, but the way we understand the guidance is you have up to 5 academic days to make this change. So if you would go from in-person learning for all students and all of a sudden you had to go into a hybrid, they're telling us that they're going to give us up to 5 days to make that transition. So up to 5 days means we could do it sooner than that, but we wouldn't have any more than 5 days to do that. And that's, again, a reason why I don't think we're going to toggle back and forth. I did have a chance to go through the statewide data on every county, and there were a few districts that if we were in session this summer, they would have went from in-person learning all the way to distance learning in 1 week. And obviously that would be a major concern for us if we had an uptick like that. And if we did something like that, we might have to take a few days to make that transition. But generally, what I've seen across counties is most of them make the change from one level to the other. They're not jumping levels, but it is potentially there to happen.
Darren, this is Joellen. My question is a comment you made where we could go up and down the dial, but we'd need permission. I thought that we could be more restrictive without permission, but not less restrictive without permission.
Yeah,
You know,
that was a question that was asked of Deputy Heather Mueller this last week, and they still said that the Department of Health would have to be consulted and they would have to approve that. But I think that that would be very likely they would approve it if you were more restrictive. And obviously there are some districts across the state that have chosen that, and the Department of Health has already put their stamp on that. Does that make sense?
the other question I have, yes. The other question I have is thinking about staff and thinking if it's staff rather than students that become ill, then at some point we're not going to have the staff to cover the students. And is there a plan for that?
Yeah, there are protocols put into place for staff that might get COVID, and that would always be part of the decision. Absolutely. I think toward the end of the slideshow here today, we've got some of that information more as an overview. But if you have specific questions on that, I could certainly guide you in the right direction there. Any other questions on this slide? Okay, I think we can move forward, Tina. So as I mentioned before, there's going to be new calculations weekly. They're going to come out on Thursday, and we're going to try to do as much district tracking as we can on a daily basis. As Brian said, a lot of the information we're going to get on those Thursdays is going to be, a couple weeks old already. So we really want to have real-time data as best we can and the most accurate data, so we're not surprised when we get those numbers on Thursdays. So at this time, based on our number, the Department of Health and the Department of Ed would recommend we start in-person K-12. And as it's been mentioned a few times already, we could still dial forward or backwards based on whatever our status is with their approval. I've had a number of families and staff people contact me about making a decision to start in person at this time because we don't know. The reality is we still have a couple weeks worth of data prior to our first day of school. And even if we decide that the right thing to do is to start in person, we may have to change that decision before the first day of school if the numbers warrant that. And I think the important thing is for everybody to understand that this is really going to be based on the conditions, and we're going to have to expect changes as we move forward. So here's the public health guidelines that have been outlined for us. You'll see the bulleted items here are some of the main topical areas that we've gotten a lot of detail on. We're going to give you an overview on kind of where we're at in each one of those areas. And then when we're done with that, we would take any questions that you might have. So again, our number one priority is student and staff health and safety throughout this thing. And that will be our priority as we plan for the first day of school. Social distancing and minimizing exposure. This is almost a priority list. Probably our biggest concern was transportation, and then our lunch and breakfast programs, band, choir, music. We've got some major concerns there. And then we get down to classrooms and restroom use and that sort of thing. So I'm going to just let our directors speak to those. Brian, I don't know if you had anything else you wanted to add for transportation.
Nothing really. We're going to try to even those load counts out the best that we can. And with the high number of families that have opted out of transportation and us being able to seat siblings in the same area, we're going to be okay. But that still is our largest density in one small spot over a time period. One of the good things that I mentioned to Mr. Vanderheiden the other day is a lot of our high density stops are very close to our buildings. So that high density of student will not be on the bus very long. So hopefully they're getting on and off within about a 10-minute time period.
And Brian, I think from a routing standpoint, the strategy is to really work through those numbers based on our current routes. So we're not building brand new sets of routes. We're pulling those kids out of the current routes that we have and then making minor adjustments. Is that correct?
Correct. We want to keep our routes consistent. So if we do have to toggle back and forth between different educational modalities, that we're not going to have to route kids with a different bus driver. We want to keep it consistent and give us the ability to toggle back and forth without causing a lot of trauma to rerouting with families, students, and the bus driver.
Sure. Thank you.
Brian, this is Byron. So if you opt out, you're out, right? You can't, next week, you don't have a ride for your kid and they can just jump on the bus. Once you opt out, you're out, correct?
I think, I don't know if Mr. Vanderheiden is going to speak to that, but we're discussing internally on a protocol for changing decisions on when that might occur. And I think I'll throw that back to Darren.
Okay.
Yeah, Byron, I think if there were a substantial change in their family, all of a sudden they didn't need a ride, now they do need a ride, we're going to do everything we can do to make sure that we can get their child on a bus. And we may have the other thing happen too, where Some folks maybe would have not opted out, and now they have the ability to do that too. So we're going to stay flexible with that. And as Brian mentioned earlier, we're very appreciative to those families that stepped up and said, we'll opt out, because we know many of our families can't. That's the only way their child can get to school. So we're going to be as flexible as we can with that as well, and keep our density, keep our numbers down so everybody's safe.
And that was part of that decision of not changing the bus route. So an example, if your student rode bus 7 last year, probably going to ride bus 7 this year. And those students that have opted out, we're just going to bypass that stop. We're not going to change the route. So if somebody did change their mind due to extenuating circumstances, it'll be easy for us to get them back on that bus route.
Does that answer your question, Byron?
Yeah, I guess I just don't want people to think that, for some reason on Friday, Johnny doesn't have a ride, so and the bus pulls up here, we'll just get him on the bus and he can get to school on Friday, but that's just the only day, you know what I mean? Not someday he does, someday he doesn't, whatever. If you opt out, there's got to be some kind of circumstances that you're going to opt back in for the whole year, not just one day here, one day there.
Yeah, and in a normal year, something like that does happen, and we're able to accommodate that. But because we are trying to keep such strict protocols with COVID-19 conditions in place, that what you're talking about there probably wouldn't be appropriate.
Right, because if we have a seating assignment and then all of a sudden the kid shows up that morning, now where do we put him? And
correct.
Throws a wrench into everything. So okay.
Correct. Yeah. Lunch and breakfast. Becky, are you on? I know Becky's been working with Leslie on this, so could we get an update on that?
Sure. Leslie's in another district, so I can provide an update. With respect to lunch and breakfast, we're going to be using a lot of the guidance and applying it to the lunch line and the cafeteria space like we are doing in our classroom. So because we're returning in person, we're going to try and implement as much distancing as we can. So we can just kind of start at the beginning of what a lunch line would look like and walk through to the end. Maybe that's a great way to walk through it. So before the students go through the lunch line, they will hand sanitize. They will communicate through sneeze guards with the food service staff. The food service staff is going to pick up a disposable tray, and they are going to pass that from staff person to staff person, placing the different food service components onto the tray for the students. So we will not have students handling any of the serving utensils. At the end of the line, the guidance we're getting right now from USDA is such that the student has to still have an offer versus serve component. So they will pick up their milk if they would like to have that milk. Water is still available. And then the students will go through the line approximately 6 feet apart. There will be spacing markings on the floor, is my understanding. And I know that all the admin team is going to work through what the signage is, what those markings look like, so on and so forth this coming week. When they leave the lunch line and they have their milk, then if they're in the elementary, they will have been lined up alphabetically. And then when they reach the point of sale person will have a barcoded printed document, and then that student can state their name, and then the point of sale person can scan the barcode on the paper so that we don't have many, many hands touching or keying in numbers all on the same keypad. Then when the student leaves the lunch line, they will have more than one place to decide about sitting, and there will be supervision to assist with that process. So it won't be the cafeteria only, so that we can spread students out. We will have multi-purposes rooms at play. We'll have other classrooms at play. It really just depends on the building, what those additional locations are. I do also want to update you that we have a waiver submitted to the Minnesota Department of Education, because as an administrative team, we may provide breakfast to each K-5 student at the end of the day. That way they would take it home with them and then have their breakfast available before they would arrive back at school the next day. We do not have approval for that at this time, and we're exploring other options if that waiver were not to go through. But we have submitted for that sort of model at this time.
And Becky, just to give some more detail to that, The idea there would be to just limit that exposure in another meal and gathering all those students in the cafeteria again or in classrooms.
Correct. Yes.
Yeah. Becky, and maybe you mentioned this and I just missed it too. Are we expanding our lunch periods as well? So not only are we expanding the space, but the time it takes to eat?
Yeah, that's an excellent point. I didn't touch on that. Thank you. In our high school location, for example, we typically have 2 lunch periods, but now we're in discussion with the high school principal and assistant principal, for example, to have 3 lunch periods so that we spread the kids out over a greater number of periods and then have a greater chance in the spaces that we have available to spread students out as well.
Okay, thank you. I think Becky would be willing to take any questions that board members might have on our food service program.
Absolutely.
This is Tiffany. I've got a question on the lunch. Will students be able to choose who they sit with? Or will that be something where they go with their classroom cohort? Or do we know what that looks like yet?
I think there's discussions happening right now, and I have heard administrators talk about potentially having seat assignments, but I guess what that would look like is still to be determined. That's a really good question, and like I mentioned, we're going to be following up on markings for floors and signage, and I will ask the administrators what their thinking is as far as that would go.
Yeah, I think the latest conversation on that was to literally have a seating chart for lunch. And I know that doesn't give kids a lot of freedom or a lot of independence, but based on our current situation, it's probably the right thing to do.
And then I'll ask a question about breakfast as well. If we're going to eliminate breakfast, I'm wondering how, if we have half of our families dropping students off at the buildings, what that's going to look like logistically, and if they're not going in for breakfast, are we going to alter sort of drop off times or anything? That kind of goes back to the transportation thing, but I imagine it could logistically be a little bit more traffic heavy.
Yeah, I can take a run at this, and then other folks can certainly add to it. But we are talking about a range of time for drop off and delivery, not only from parents, but also from bus transportation, because we certainly don't want kids out on the playground mixing before school starts. So we'll have some protocols there to get them in the building. And I just want to be clear that we're not suggesting eliminating breakfast. What we're suggesting is doing breakfast very differently. So we still want to provide breakfast for those kids that need it. We just would like to give it to them the afternoon before they need it. And we've talked a lot about that, how many kids are going to eat that breakfast on the way home on the bus. So that's one of the dangers of doing that, but it does limit the exposure. We're still providing the needed nutrition that they need to start the school day. But again, we don't really even have permission to do that at this time. That's just one of the models that we're considering.
And in our secondary location, breakfast would look different. It would not be a potential send home the night before. In those 2 locations, administration is strongly leaning towards a grab and go style breakfast. However, at the high school, it would be moved up towards the beginning of the day so that we can shorten passing times and minimize exposure. And then at the middle school location, it would be a grab and go before the school day would start, but then they would take that to various locations within the building. I know we talked about additional garbage cans and different protocols that way.
Other questions on lunch and breakfast? Okay, let's, if there aren't any other questions, let's move into band, choir, and music. And Mike, can you speak a little bit to that as far as where the principals' heads are at?
Sure. This is Mike Scott, Director of Teaching and Learning, just for the folks at home. Band, choir, music, we know that we've seen guidance in the Department of Education, Department of Health, specifically speaking to choir and band, and what our middle school, high school, and we know we have band also at Park Elementary, are talking about is utilizing outside as much as possible. We know that'll change with weather conditions, We're fortunate to have beautiful auditoriums in all three of those buildings where students can be spacing out considerably in order to be participating in those in band and choir and music classes. So they are looking at and analyzing those rooms to see how far apart all students can be, and that's a current plan at this time. Some other things that may have to happen just based on space, for example, at the middle school, is how many can be in a class at one time, and rotating some of those things so that if there's a class of 100 students in choir, for example, at a certain grade, that they may have to do some things with their schedules to be rotating those. So the principals are in the works with looking at that as well.
So Mike, you're suggesting a lower density by, say, breaking those groups, that large group up into maybe 3 groups. So instead of
Correct.
100, we'd only bring 30 together at a time.
Correct.
In a large space.
Yes. And the same piece is going for the classrooms. Teachers are, our teams that are meeting right now, our leadership teams in the buildings. Principals have also been looking at this in terms of what our classroom spaces will look like, what items are that are in our classrooms right now that maybe aren't essential things that are taking up space. And everything's essential in our classrooms or they wouldn't be there. But if there's bookshelves or some storage pieces that need to be moved or stored in a different location in order to maximize the spaces in our classrooms, those are being analyzed. I know that we see in the guidance that those terms, we've had parents and families ask about what does it to the extent possible mean when we talk about social distancing. And we are going to strive for that 6 feet apart for our students. We know the extent possible is, for example, a student getting out of his or her desk and going to a pencil sharpener. Since, on an assembly line, that would be possible to do that. But in a classroom, if a student moves from a desk and isn't technically 6 feet apart, that's the extent possible, or walking out of the classroom, or there's going to be some certain instances where that may take place. And to the extent possible, we're going to continue to strive for that social distancing.
And Mike, what we're really trying to prevent with that is long periods of time being within that 6 feet as well. So I think the standard right now that the Department of Health is using for schools is 15 minutes. You don't want any 2 people together within 6 feet, even for up to 15 minutes, even if they have a face covering on. That's
correct. And when we've had questions about, and this may be coming later too, about what would happen if there was an exposure, and you've spoken about talking with the Department of Health, and one of the first questions they're going to ask is how many students or how many people, and were they within 6 feet of each other for more than 15 minutes? And that's one standard question that they would ask.
And Brian, I see that you're nodding. Is that a industry standard? Is that a local standard that other industries are using within Hutchinson as well?
That's the Minnesota Department of Health standard. So that's the one that's being recommended broadly throughout the state.
Okay. Not just for schools.
Correct. And when we do contact tracing at the hospital, as well as Minnesota Department of Health, that's the first question when someone says they've been potentially exposed is, were you in contact with them within 6 feet for longer than 15 minutes? And if the answer is no, then that's not considered a positive exposure. But if it's a yes, then then we need to start going down that trail a little bit further.
Okay, thank you. Mike, did you mention restrooms, or maybe Brian? I know you've been involved with those to make sure that we're keeping them clean as well. Do you have any other information on restrooms?
Turning my mic and camera back on. So just in general, when it comes to both classrooms and restrooms, we're going to reprioritize our custodial work effort a little bit. We're going to be cutting back on the vacuuming. I know that does have a hygiene component to vacuuming, but a lot of it is aesthetic. And we're going to be refocusing that time into disinfecting the high touch areas, which includes the bathrooms, handrails, doorknobs, all of those things. So that will be the focus of the cleaning effort, and then scaling back on the vacuuming.
Okay. Any other questions at this time that we can answer? Okay, I think we can move forward with Tina. Face coverings. They will be required for all students and staff. MSBA is suggesting that they were going to have a policy, a draft policy ready to go by the end of this week. I haven't seen that yet. It may come yet this afternoon, but it does look like we're going to have to adopt a policy on face coverings for students and staff, and to have that model policy in place prior to school starting. An alternative to the face coverings is going to be face shields. As much as the Department of Health says this is not a great alternative, it's really the only alternative we may have for some health issues. So that's the direction we're going to go with that. And then one of the concerns that I continue to hear from families is, how are we going to have our children wear face coverings all day? And all of us have been through this, so we kind of understand what that's like. And it's not very comfortable, and sometimes it prohibits us a bit. So we're looking at having some face covering breaks built into our schedules throughout the day to get kids an opportunity to go outside and have some relief there. So questions on face coverings?
Yeah, so Director Wilkie here. So just thinking of a couple things. The first question would be, when we're talking about those, was there some state money that's coming to help purchase masks / face coverings as well?
Yeah, part of the state's commitment to schools and trying to get schools reopened is, I completed the application earlier this week. They are going to send out a cloth face covering for every single teacher in the district. They're also going to give a face shield for every teacher, and half of the support staff will also get a face shield. And then I think for our district, it's approximately 10,000 disposable masks for those kids that forget their masks. So we are going to work through our regional support teams, which in our case is the Southwest West Central Co-op in Marshall, and those items will be procured for the district, and we'll pick those up prior to school starting, or that's what they're telling us.
Okay, otherwise it would be up to each individual family to, if you don't want to wear a disposable mask, you can wear your own or provide your own as a family then.
Yeah, and we know, because it's a state mandate at this point, that people have their own masks at this time, and they can certainly wear those, but we also know human nature is we don't always remember. So we want to make sure that we have some disposable masks on hand for those kids that forget them, or leave them on the bus, or drop them on the way to school, whatever that might be.
Okay. And then hypothetical, just anybody can answer this. Like, I've got 2 kindergartners and they're 5.5 years old. I'm just trying to think of them, and I understand the mandate and everything, but how does that work throughout the day? I mean, 5-year-olds or 5-year-olds, they might want to take them off. They might be upset. They might want to trade them with somebody else. What does kind of that look like, as far as, hey, is it a teacher's responsibility to say you need to put your mask back on, or what does that kind of look like throughout the day?
Yeah, it's really not going to be an option for our kids. Our priority is to keep everybody in that environment safe, so we need to hold tight on that. But we do understand with especially our youngest kids, they're going to have a difficult time doing this, and we're going to have an educational component there as well to teach them how to handle using the mask, putting it on, taking it off. And I think even for our youngest kids, those mask breaks are going to be really, really important, so they can spend some time without that mask on. So I don't know if anybody else has anything to add to that.
Hey, Darren, this is Keith. So what has the experience been with daycares? As far as I know, they have continued to operate through this kind of a mini classroom setting with adults and kids. I'm not sure what the procedure, the protocol has been for wearing masks in those settings. You know?
Yeah, I'm not sure about the masks. I'm not aware of any major issues with daycares locally or statewide at this time. Somebody else might be able to answer that question.
I can just give you, I know, Brian, you're going to chime in too, but we go to Little Lambs as an example, and the girls and all or go there, and all the kids they do not wear masks there. We as parents have to wear masks on the way into the building and in the building, and then we can take them off when we get out. But they've been going there since March and haven't worn masks, and the staff doesn't wear masks either. Just that's the experience I have.
I was going to speak not to daycare per se, but more towards the medical side with kids who do need to wear masks from their medical conditions. You know, I'll talk about like a 4-year-old who's got leukemia and is immunocompromised, and they need to wear a mask just to protect themselves. Generally, the experience we've had is that just like with anything else with kids, it takes a little bit and some reinforcement to get them used to it. But once it's locked in and solid, pretty soon they're going to be calling their parents out on why they don't have their masks on. So it's something that I think they'll adapt to very quickly.
And I should have differentiated as well, because our 3- and 4-year-old preschool students will not be required to wear a mask. It's just the K through 12 students that will.
Yeah, this is Mike Scott again. There was some different guidance for childcare settings where they could, if they had childcare for younger children, 2, 3, 4-year-olds that don't have to wear a mask, and then they were also providing childcare for older students, they could waive that mask or face covering requirement. But the Department of Health and MDE has talked about, I know there's that 5-year-old threshold, but if the student is in kindergarten and 5 years old, they still have to wear a face covering. So I know there's been some questions about that from parents as well. But if they are in kindergarten and 5, they would still have to wear a face covering. So there's a few differences with childcare, and then when they're talking about a K through 12 setting.
And there will certainly be exceptions to this where a face shield will be adequate protection. I'm thinking of some of like our speech students and things like that, where that visual contact with the teacher is going to be really important, and we would use face shields in those situations. Okay, I think, Tina, we can move to the next slide. Protecting vulnerable populations. I don't know, Karen, if you want to speak to this.
Yes, most definitely. We've had a lot of conversations with families regarding their children and if we need to put more accommodations in place in the classroom. So we've been having those conversations with families, talking about concerns if they're not able to wear a mask due to their disability, that we're going to try that face shield as well. And if that doesn't work, then we, put some other things in place within that classroom to keep the staff and students safe. We're going to have very individualized plans for students. We do have students with more significant medical needs. And so I've been meeting with Brian Moore to just talk about different things we can put in the classroom, different ways we can set up the classroom and spacing to make sure that we can keep all of those students safe. Also, we do have some students that have opted for that distance learning. And so if they are a student that has a disability, we'll provide those same accommodations that they would have within the school, through that distance learning option. So we're working really individually with families to make sure that we, make sure they know that we're going to keep them as safe as possible here at school.
And Becky, maybe you can talk a little bit about the things we're doing with staff, those accommodations, the collaborative process we've used to try to keep them safe as well.
Absolutely. So we did administer a staff survey where they could indicate comfort level, concerns, indicate whether or not they plan to return if they're uncertain. And then we're using that along with our data and records from this past spring. We had a pretty good idea of which staff would need accommodations or that extra individual conversation from what we navigated together in the past. And, we're putting safety first. Superintendent Vanderheiden talked about the PPE that's being routed to Marshall for our school district and the other school districts in the region by the state. One clarifying point there is they are sending 50% of our hourly staff face shields, but we do have an opt-out from our salaried or certified staff, where they're sending one each, because we know already from conversations we've had that not every salaried staff person will accept a face shield, whereby they're opting and prefer the face mask. So if there is a need or a request for a face shield for hourly staff, we will work to accommodate that. Hopefully we can find some companies too that don't have extremely long lead times. And I've been in touch with a couple of local vendors as well, which is fantastic, if we need to purchase some shields in addition to what the state is allocating to us. And then, how the staff accommodation process begins is, if a staff is requesting accommodation through our HR office, they will submit a doctor's certification, a doctor's note, if you will, providing additional details. And then what happens is the administrator that supervises them starts with an individual personal conversation where together we can try to figure out what the best options are in order to make sure that that staff person can safely complete their job duties. There may be additional plexi equipment installed. There may be situations, depending on doctor's orders, where a staff member needs to work alone in a classroom and deliver virtual instruction. There may be different scenarios, and we're going to follow all of the labor laws that are at play. We're going to follow the executive order and all of our contracts in order to find a collaborative way to solve these problems and manage these unique situations for our staff. I can take any questions.
Another important component of our plan is the hygiene practices, as far as scheduling hand washing protocols.
Darren, this is
Yes.
This is Joellen. I had a little trouble with my computer.
Okay.
I have quite a few questions about staff. If we could
Sure.
go back to that, because I was under the impression that it wasn't only for medical reasons. I was under the impression that it was also a choice. And I think of examples where maybe you have a parent that you're caring for, or young children that are health compromised. So I have a question about that. And also I wonder about the 305 students that we need to distance learn, or did you provide distance learning? Wow.
Yeah. Joel,
I don't know. I just really.
I've got a
like
slide
this
on
is
the
like,
distance.
Okay.
I've got a slide on the distance learning piece and kind of how we're gonna the plan moving forward with that. As far as your other question, as far as the medical needs, those are our highest risk folks. And you're right, there are some other conditions that we're going to deal with through FMLA or other programs as well. And I'll let Becky chime in on that with some of those individuals.
Certainly. So if you remember the Family First Act that went into play April 1st, the COVID sick leave with the 80 hours of sick leave for employees, that carries forward until December 31st, as does the extended FMLA. If all of a sudden one of our staff members were to find themselves without childcare, that's where the extended FMLA comes into play. And then in addition, if we have staff undergoing really intense procedures or treatments, they would have their sick leave banks to rely upon. They would also be eligible for a medical leave of absence, which would come through the board for approval. And then there may be alternative work arrangements as well until there's a vaccine available. But again, those are individual. The employee definitely has some choices, but we also have to ensure that we're meeting all of our student needs across the district as well.
I just think that families really struggled and are continuing to struggle with making a decision about where their children should be. And I think a lot of our staff are also have families, and they're also thinking about their own situation. And it isn't just, I need to go to work or I don't need to go to work. It's, I'm going to work and I also need to be healthy. I'll keep my questions maybe for Monday.
Sure.
Certainly.
Yeah, you're welcome to ask questions as we go through this today as well, Joellen. I didn't mean to cut you off earlier. It's just the lag time in the sound on the computer. So I really wasn't trying to cut you off. Hygiene practices. As mentioned earlier, we're looking at some scheduled hand washing protocols when they start school, when they leave school, and they transition from one room to another, before lunch, after lunch, those kinds of things. And we're also going to add some hand sanitizer stations throughout the buildings. And maybe, Brian, you can speak to that.
Sure. Some of my staff right now are building wooden posts that hold hand sanitizer dispensers on them currently right now. And we're ordering everything that we can get. One of the things that we're seeing out there is the availability of product is limited on a lot of these things. So we're trying to figure out every source of supplies that we can right now to make sure that we have them in place by the time school starts. Just FYI, our normal cleaning products that we use on a daily basis and have been certified to protect against COVID-19. So we haven't had any supply issues when it comes to the normal cleaning. It's just ramping up for all of these additional hand sanitizer stations is where we're seeing a little bit of a pinch in supply right now. So any help from families, if they could send hand sanitizing bottles with their students, would be much appreciated.
Yeah, I know, Brian, at one point we talked about that as being a back to school item as well.
Yep.
I don't know where principals are at with that.
Yeah, one of my suppliers today I was talking to was I'm trying to get the largest pump hand sanitizer bottles that we can. And he said they're pushed out until September. And I reminded him September is a long month. Let me know if it's the beginning or the end. But we're trying to get everything we can at this point.
Right. Any other questions, comments?
Is there another slide? This is Joellen again, about the school nurses. Will every building have a nurse on site or nurse's assistant?
I'll hand that one off to Karen if you could comment on that, Karen.
Yes, so we will have the building nurse in each building, and then also we have our district nurse. We have a new district nurse who will be starting next week, and will be trained in by our prior district nurse. So we have all of those pieces in place. They are obviously a very important part of planning for each building with these hand sanitizing and all of that. I know they'll be involved in lessons in classrooms to make sure kids are washing their hands the correct way. So that nurse will definitely play an important part in each building. But yes, we will have those positions staffed throughout the whole district.
Karen, is it true that Dr. Pullman has volunteered to come in every morning before school starts?
Yes. Anytime we have a vacancy, he will be on call to come in. So
Guess I need to free up my calendar a bit.
Yeah.
there you go.
I was just making sure you were paying attention.
Yeah. I do have a quick follow-up question to that line of conversation, though. Has there been any recommendation on screening for symptoms or temperature screening or any of that type of thing with the kids? And not to say it's trivial, because it absolutely isn't, but I'm just curious what the Department of Health is saying on those topics.
Yeah, we certainly are going to ask our parents to do a health screening prior to each child leaving their home. We are also going to ask our staff to do an observational physical screening of kids throughout the day. And if there's any kind of symptomatic things going on, we got some protocols in place to deal with that at school. It's going to be really, really critical that parents do that health screening and make sure they don't send any child to school that's sick. I don't know if you guys have anything to add to that. We've talked a lot about that and how we're going to do that and try to keep everybody safe. Mike, I don't know if you've had conversation with the principals on that.
Yeah, we'll have some more information as we'll talk about here shortly in the frequently asked questions document that we'll be gathering these items and putting that out to families next week. But using the CDC guidelines about certain things that they should be looking for in their children before they're sending them. And then following the CDC guidelines in terms of what we should be doing for just a visual screening or watching students as they're coming in for some of the symptoms that potentially warrant maybe a referring to the school nurse.
Okay. Thank you. Cleaning and material handling. I'm going to ask Brian to speak to that. He's made a few comments in that area, but he probably has some more detail he'd like to share.
Sure. Yeah, I think I forgot that this slide was in here, but as I mentioned earlier, we're going to be scaling back on our vacuuming and then focusing their cleaning effort on those high touch areas throughout the days and cleaning and disinfecting those. What we're also doing with custodial staffing changes is we're going to move some evening custodians from the evening onto the day shift so they can be there where our highest densities of students are and stay on top of those high touch areas like the restrooms, the railings, the doorknobs, those things when the students are there. So if there's any other questions, I guess I can get a little more in detail if anybody'd like. Thank you.
Monitoring for illness. We just touched on this a couple slides ago here, but again, we're going to ask our parents to do a health screening prior to the child leaving for school. We are going to do some of that with staff members as much as we can in an observational kind of mode, and we will be using our school nurses as well. And then there will also be an educational component to this, just to make sure that everybody's got the hygiene down. They understand what a screening is, what they should be looking for. And then again, the last thing is just staying home when you're sick. That's going to be critical for staff and students.
Darren, this is Tiffany. I just wanted to clarify that educational piece will be for families as well, right?
Yes, there'll be a family component and there will also be a student component within our, back to school information when kids come back to the building, if that's the decision. Oh. So this was brought up earlier as well. Here's some additional information on it. So how are we going to handle suspected or confirmed COVID-19 cases? Schools are going to be required to have a separate room to isolate either a symptomatic or obviously a confirmed COVID case that would be within our building. So each building has developed a plan for that. They've identified a room. And the idea there is you don't want somebody that could have COVID with somebody from the playground that fell and scratched their knee or something like that. So there is going to be a separate room. We are going to have those students supervised within 6 feet. So they're not in there by themselves. And they will stay in that location until the parent comes. And then that staff member would walk that student out so they could go home with their parent. As far as the actual cases themselves, we're going to be required to contact the Minnesota Department of Health. And the Department of Health is then going to work with the family, our local public health, and then our regional teams on taking care of these situations. So that's going to be our protocol. We will have more detail on that as we move forward. And getting back to the confirmed cases, if there's a confirmed case, those individuals would be quarantined for 14 days. They wouldn't be allowed to come back until they're symptom free. And then there will be some contact tracing. We talked a little bit about this earlier, but close contact, according to the Department of Health, would be being within 6 feet of that individual for 15 minutes or more. And it looks like right now they're talking about that contract tracing. Then there would be testing going on from the 5th day to the 7th day of that close contact. So the Department of Health is suggesting they're going to give us more information on that, but that's what they've given us so far. Questions in that area? Brian, is that similar to the protocols that you're aware of in other industries and other places?
Yeah, that's the standard that we're using. The only comment I would make would be around the testing. Right now, there's not enough testing supply to do that test at day 5 to 7. And even if it were done, that test doesn't necessarily guarantee anything. So if that test is done and it's negative, that doesn't preclude later illness. So really the 14-day quarantine would still take effect whether that test is positive.
Yeah, that's the way I understand it too. My understanding of the 5 to 7 days is that gives the infection or the disease a chance to show up on a test. Is that correct?
Yeah, usually the time frame it takes for that disease to start showing itself, to get past that incubation phase, is on average 5 to 6 days. But again, it can be as long as 10. So that's why I say that the test in that time frame would catch most of them that are people who are getting infected, but it would not preclude all infections. And so that's why that 14-day standard is still there.
Sure. One of the other items that the state is suggesting they're going to secure and give to school districts is a saliva test for any staff members that are symptomatic or believe they may have it. And it sounds like you can self-administer this saliva test. They're telling us they would turn that test around in 24 to 48 hours. I haven't heard any more than what I've just explained to you. And so I'm hoping to get more information on that. But that's my understanding as far as educators and staff members go.
Yeah, that's it. From my standpoint, Darren, that's not anything I've seen used yet. It's a fairly new test, and I can't even comment on how accurate it is at this point.
And maybe that's why I haven't heard anything else on it. Water and ventilation systems was also part of the protocol and part of the public health guidelines. Brian, can you give us a quick overview on what you're doing there?
Absolutely, sure. So the first part with the water systems is there was a concern from the Department of Health that several school districts chose to shut their doors over the summer and last spring. And there's a concern when you shut down water systems, particularly with large storage tanks or certain types of chiller systems, that Legionella can develop in those systems. So they wanted to make sure that everything was flushed, cleaned, and functioning to flush out any of those contaminants that may have settled there during the season. We did not shut anything down. We've had staff in the buildings, maintenance and custodial staff, plus we've had summer school and other things. We did not shut anything down. Everything still has been continually flushed, so there isn't a concern over that. And we do not have the type of chillers that have the systems that blow water over coils and can produce Legionella in some of those systems. The other part of it is the guidance is to maximize our air handling systems to bring in as much outside air as the systems can tolerate. 4 times a year, we change our air filters in all of our systems. We're just finishing up our summer scheduled maintenance right now. So when school starts, all of the filters will have been changed and all of our air handlers will be adjusted to maximize that outside air that's coming into the building.
And Brian, you can leave them in that with that setting until it gets really cold, I understand?
Right. Some of the systems, as the outside air temperature gets cold, you're limited on how much air you can bring in because otherwise you'll freeze your coils and pipes and other systems. So it modulates based on what the temperature is, but at no setting, there's always outside air that that's being brought into the building. So there isn't ever a point where we're just recirculating our inside air. Any questions for me or? Thank you.
Transportation guidance, we talked quite a bit about this. I think we hit everything on here. We'd take any additional questions that you might have.
I just have one thing to add, Darren. So one of the things that the bus company is going to do is between the routes. So we route our secondary students first, both in the morning and the afternoon. They are going to disinfect all the seats and those surfaces on the bus between those routes. So when the secondary kids get off, they'll start cleaning their buses before they're back into service to take those elementary students to or from school.
Yeah, thank you. Supporting mental health and well-being. Karen and Mike, maybe you two can make comment on these.
Sure. Well, within all of our buildings, we have social workers and counselors who are able to support our students and our staff members. As we know, mental health is something that has been a concern throughout this pandemic. So we want to make sure that we provide that support to our staff and also our students. We are also looking at increasing our contract with Woodlands, who come in and provide some one-to-one support to students and families. So we're looking at increasing that, as we know there has been an increase in students that have that social emotional need throughout this pandemic. And as we come back to school, there's obviously lots of worries and concerns. So we want to make sure we address those. I know our social workers and counselors will also be providing lessons in classrooms and working with teachers to make sure they also can work with those fears that students might be experiencing or concerns that they may have, as we're obviously entering something that none of us have experienced before. So we want to make sure that we provide those supports for our students and our staff.
Thank you. I want to briefly touch on our distance learning model, and I would invite Mike to speak to this. I know he's been working very closely with the principals on this. Our distance learning model at this time is going to be a little bit different. Right now, K through 5, we're looking at a designated distance learning teacher per grade level. So according to our numbers, we probably have enough students that have opted into distance learning, and we're thinking that that's probably the most efficient and the best way to provide not only in-person learning, but also the distance learning piece. And then the 612, we're looking at having a classroom model where the individual teachers that are teaching those courses would also deliver to students face-to-face, in person, and then they would also have a distance learning component to their class. So Mike, can you give us a little bit more detail on that?
Sure. So I know that we did, obviously we spoke earlier about surveying our families and realizing and recognizing that families didn't have a lot of detail about what this might look like. It's kind of the cart before the horse analogy, I guess, is that it was important to know how many were possibly looking at that to see what our delivery model might be. If there were 2 students per grade level versus 20, that really did help us inform our decision. And we know that once we give some more details here, that families may have a clearer picture. There may be some changes they want to make, which is certainly possible. Looking at this delivery model K5, as Darren spoke to, is that we really want to have a school day of 8 to 4 elementary and 7 to 3 secondary. We want to have a consistent schedule for students. We know this isn't a short-term item like it was Tri-3. We knew that school was going to be ending in June. We still had uncertainty at that time whether we were going to be coming back. We were transitioning to something we never did before, but the state has learned a lot. We have learned a lot about what best delivery model will look like, but we know that this could, that their students are choosing this for their whole schooling, and we may have to transition to this potentially with students who are coming back in person. So we do need to have a model that is very consistent scheduled routine for our students and our staff. That distance learning is if they're having math lesson at 8 o'clock in sixth grade, that students are logging into their classroom and able to see that classroom live and getting the instruction from the teacher and be able to work on that work during that time, and then being prepared for their next class. Same thing for the high school model. We know that specifically with 612 students, we don't have a lot of flexibility with some licensure items. If a student wants to take a business class at the high school, for example, we have 2 teachers that can do that. There isn't the flexibility to assign a total online teacher for some of those courses, nor do we have a large number of students that may even be taking those courses that are distance learning. So we have gathered our principals, I should say, have gathered feedback from their building learning teams, which is consisting of teachers and paraprofessionals and a number of other folks. But in terms of the distance learning piece, the suggestions coming forward, the recommendations has also come from them, and getting their guidance and their support with that. So their voice has definitely been heard in that. So next week we'll be sending some more frequently asked questions documents to our families about specifically more about what distance learning will look like. But again, the K-5 will be a specific online teacher, distance learning teacher for that, but following a daily schedule that is very structured. And the same thing with 612. If a class is going on, a math class or English class, for example, that's happening that they need to log into, it's going to be following that school day. School is from 7:30 to 2:30, for example, at the high school, middle schools, give or take 5 minutes on each end.
Hey, Mike, this is Chris Wilkie. So when we talk about that, as far as the delivery, is it an actual, like you were saying, so high schoolers doing distance learning, let's just say as an example, and they log in at 7:30, and would they watch the class on video and be able to see it that way, or does it not work that way?
Yes, that's what we've talked about, and maybe not necessarily the whole classroom, but definitely seeing the teacher's instruction, the teacher's delivery of being able to see that. It's potential that the teacher could even record that lesson for other viewings for students who may have to transition in and out based on their situation, and then being able to have that work time to do that at the same time as well.
Okay, but in K-5, not necessarily that way with video and things like that. Would it be more along the lines of what they did last spring?
It would be with a Google Classroom, with being able to see that teacher, seeing their classmates, being even more individualized as well, where they could say that at certain times of the day, they're also going to be meeting one-on-one or in small groups of students, while some other students are doing some things on their own. But it's going to be very structured, very during that school day. That now we do realize, we've talked a lot about this, that there's going to be students transitioning in and out. They may say, well, I'm in person right now at an excuse me, at an elementary level, and say I'd like to go distance. That means that, for example, that student would leave the classroom that they have with a teacher and going to the distance learning teacher. Or it could be vice versa, somebody that's on with the distance learning teacher in third grade, for example, and saying we're comfortable sending our child back. What does that mean? And we're really going to have to work with that on a case-by-case situation. Would they go to a different teacher? We're going to have to really collaborate with our teacher leadership teams, our principals, the families. There really isn't a perfect answer. We know that the relationships they build with their teachers is very important. Given the circumstances and the situations, it's very hard to maneuver all of those pieces to know what it will look like. Will I have the same teacher or not? It's going to depend on numbers and the situation. And I wish I had a better answer, but we've been back and forth with that as a leadership teams, really discussing that.
Mike, is it fair to say that the guidelines have changed significantly as far as last spring's guidelines from MDE on what distance learning is? As an example, we're really obligated to do more synchronous kinds of learning through distance learning. Attendance policies have changed. Academic expectations have changed since last spring. These are some of the questions that we're getting. So could you just speak to that a little bit?
Yeah, they definitely have in their guidance. I think the whole state saw this. We saw this in certain areas too. That as we keep moving forward in a long-term situation, that compulsory attendance was emphasized. That I don't want to say minute for minute, but hour for hour. That students are obligated to be in school, whether that's in person or distance, and participating in that learning. That it's not condensed, that we're not reducing days, that we're following those guidelines. If a student is at home, they need to have the same instruction and equitable access to those Phy-Ed and art and those specialist areas, just like as if they were in the classroom. And I know that's a challenge, but it's something that we are being asked to do by the department, and it does give that equitable education. So as you spoke to more synchronous or live sessions, yes, that has definitely been emphasized as well. That there needs to be much more increased contact from our teachers. And again, the guidance from the state, they're seeing that if there was concerns here with that, if parents had that, the state has definitely seen that as well. And we need to increase that contact in school day with our students who are distant learning.
Sure.
This is Director Bettenhausen. I just wanted to add a comment. So when we're looking at the numbers, juniors and seniors, the numbers are pretty high. I've talked to a couple families and some students that were thinking distance learning is going to be like last year. I log in at 8:30. By 10 o'clock, I'm done. I can go work a full-time job, get my high school credits, and work. And I think once they see this plan that says, no, you're going to be online in school from 7 to 3 every day, those numbers are going to come down.
Yeah.
Because some of them were taking classes, they were done at 10 and then went and signed up for Ridgewater classes because they can get college credits and be done pretty quick at high school. And this is going to be totally different than it was last spring, right?
That's correct. If there's a distance learning student who has teacher A for a certain class, they will have to log in and see that instruction during that time and be on from that class period 8:30 to 9:30. Now, that doesn't mean that if there is independent work time that the student might be able to shut their live stream off and start doing that homework or doing that classwork independently. It's not on all day long with the computer, but the next class will be starting at 9:30 and they're going to have to log on and be available. And that's how our teachers have, our teacher leadership team anyway has emphasized or has talked about that and saying that this is something that's workable. And this is how we were going to deliver that instruction. So yes, some of the situations where people were working or I'm going to do this at night, the instruction is going to happen during that school day for 6-12 specifically because there's so many different variables. Same thing with elementary, but if there's one student distance learning in a certain classroom, their class is happening the same time the in-person students are happening. So their school day is 7:30 to 2:30, and that's when they need to be obligated to be in school or will be taking attendance and they'll be marked absent.
Right. So once this is communicated out to everybody, I think those numbers are going to go down as well. Because they were thinking they were going to get out earlier and be able to go to work. So I'll do the online thing, then I could be done sooner. I don't have to go to school and be there till 2:30 or whatever. So I think that number is going to change, but I could be wrong.
So Mike, this is Keith. So
yeah.
The truancy grading academic expectations will be similar to what we normally would have had in a live situation prior to this pandemic. Is that correct?
Yes, that's correct. I think that we'll always be cognizant of situations that families would have difficulty with attendance and take those into place and working with our county truancy. But students are expected to be in school, whether that's in the building or distance learning, just like before. Those same rules or compulsory attendance obligations will apply.
Good. Thank you so much. I heard from quite a few parents who were pretty unhappy with the level of expectations that existed this past spring. So thank you for that.
Yeah, I think there was a variance of some areas were extensive and some were maybe too flexible or flexible, trying to keep in mind when we started this in the spring, we kept hearing guidance from the Department of Ed at that time about being careful about overwhelming students. We're not sure what this is all happening. And then as we kept kind of going, I think we've recognized that we didn't maybe change or ramp it up a little more than maybe what we could have, but we weren't certain where all those areas were, and now I think we can do that this fall and throughout the school year. Are there any other questions on distance learning? That would be the same if we went to a total distance learning model with all students. That would be that way. If a whole school needed to do that, we would continue to be then delivering distance learning during the school day for that particular school or as a whole district.
I just wanted to say, to be fair, we had 2 weeks last spring to prepare, or last spring to prepare for online learning. So it wasn't perfect, but we didn't have a whole lot of time to plan or to work on it. And we kept saying, well, 2 more weeks, this might go away. We might be able to go back to school. And then 2 more weeks. So we just kind of kept dragging it along. And then here we are at the end, and we didn't make any improvements. So we've had summer to plan for this. And I think if we had to do distance learning, I think we got a better plan in place and we're ready. And it'll be much different than it was last school year.
Yeah, absolutely. Our teachers and staff did a remarkable job in a short amount of time putting these things together and getting professional development and training to be able to pull this off as well as it happened, and still giving education to our students. It really was remarkable, the work they did.
Right, absolutely.
Go ahead, Mike.
Oh, okay. So the hybrid model, and that's a combination of having some distance learning and some in person. And I know we had some families ask about whether they could choose to do hybrid on their own. Can they send their child some days and do some distance? And that really wasn't a model recommendation that the department had. It was either, if we're in person, you could totally choose to be distance all the time, or if we had a hybrid model as a district or building, you could be distance all the time. There really wasn't an option of choosing hybrid in any of those options. But if we had to go to a hybrid model, or we chose to go to a hybrid model, that would be it could be a K-12 or by building, as we talked about earlier, and having alternate days, having families divided into A's and B's, or households, I should say. I guess just for transparency, we didn't just go by last names. We know that obviously families have other last names in their households, so we went by household names. We divided those out, tried to equal them numbers out for class sizes when we have to do the 50% capacity and follow the hybrid guidelines from the Department of Ed and Department of Health. So there'd be an A day, B day, alternating days, Monday, Tuesday, Wednesday, Thursday, and then alternating Fridays. And then on those in-school days, teachers would be teaching their students in the building, and then on students who are at home would be getting synchronous and asynchronous lessons live, or items they need to do at home from the learning they did the day before.
And this might look a little bit different K-5 and 6-12. We'll have more detailed information on what this plan would look like, but I do think it's fair to say they would be slightly different. The A-B split would not be. You'd either be an A student or a B student, alternating Fridays, and we'd make sure that all the siblings, those families, were either an A or a B day, just for consistency, transportation, daycare, convenience for those families.
And I understand we got to keep all our options open, but I think this would be a nightmare. I mean, for parents that have daycare, look how many kids we have show up to school on 2-hour late starts on a Wednesday. Everybody knows the first Wednesday of the month is 2-hour late start, but yet kids show up at school because their parents forgot. I mean, if this is, you're switching back and forth, and like I said, I guess it's an option, but it's probably the least convenient for everybody.
Yeah. You know, that's one of the reasons we split our A and B, as if you're an A student, every Monday and every Wednesday you have school. We didn't rotate it. Back when I was a principal at West, we had a color day schedule where you would rotate, and it was a continual rotation, and you had to keep track of it. This way, you know, if you're a A student, you're Monday and Wednesday. If you're a B student, you're Tuesday, Thursday. The only thing you'd have to keep track of is Fridays.
I should mention too, with the distance learning model and hybrid, if we go total distance learning as a school or a district, we do have to offer childcare to critical sector workers. We still would have to determine how to deliver meals. The same thing would happen if we go to a hybrid model. We would have to offer childcare to our critical sector worker families, and also delivering meals or determining how we would get people would pick up meals during that distance learning time. So hybrid is definitely a model that we've, as you mentioned, Byron, have a lot of things to work through. It's one of those that it's definitely much more difficult when you have some students here, some not, and switching back and forth, and a lot of the other components that go with hybrid.
Plus, as a student, you might get different teaching on Thursday than you would have on a Monday, correct? I mean, are they going to, as a teacher, are you going to teach something on Monday and Tuesday, and then Wednesday, Thursday, the same thing?
We've talked a little bit about a 10-day curriculum cycle, because if you think through it, A-day kids are going to get 2 days one week and 3 days the next, and
Right.
Same thing with B. So teachers will have to be very structured as far as their curriculum and how they deliver that, and trying to keep both groups up to speed and on track.
This is Joellen. I just want to mention to Byron that there's a lot of other possible nightmare scenarios. I personally feel like this hybrid is possibly the way we should go, but I do think too that it's asking an awful lot of our staff as well. And I think other districts are doing other things. There's one I'm familiar with that's doing the AB, and then Friday is distance learning for everyone. So except they're doing K2, they're doing 4 days of in school. So there's a lot of other ways, I think, to look at this. We, our young learners need to get off to a good start. I believe that. That's all.
I've asked Nick Schmidt to give us a technology update. There you are, Nick. The real Nick Schmidt now appears in the bottom right-hand corner. Can you give us an update on the technology?
Yeah, so these are just some of the changes that we're doing for the upcoming year, and the first one I'd like to talk about is the 4th and 5th grade BYOD. Part of the reason we're doing that is to make the Chromebooks more available across the district. And every student, if we're in a hybrid model or a distance learning model, is going to need that tool for learning, and that will allow us to redistribute our Chromebooks a lot better. And so, if we using the BYOD model, we will be able to be pretty much 1-to-1 at second and third. Every student should be able to have a device, and at kindergarten, pretty much we'll probably have a close to 2-to-1, or for every 2 students, they would have 1 Chromebook. And then all our teaching staff would have a Chromebook as well. So that works really well when we go to the BYOD. And as far as internet accessibility, we still have the devices that we purchased last year with T-Mobile. So for families that need access if they're in the country, or maybe have spotty access, those should be available. For staff technology needs, we did try a few different products last year. There was a lot of different companies that were offering free trials of different products, and a few of those we liked, and we are going to go ahead with those. Screencastify was one that lets you share your screen and record your screen. Edpuzzle, Seesaw at the younger grades, and Pear Deck is another one. So those are some of the things that we're doing to help teachers engage better with their students as well. So those are some of the technology changes that we'll be doing this year. So.
Okay. Thank you, Nick. Any questions for Nick on technology, internet accessibility, any of those topics?
No, just a comment, Director Wilkie here. Absolutely love the 4th and 5th grade BYOD. I showed mine on the camera just a little bit ago and gave a thumbs up. So we're all set from in the Wilkie household, but hopefully everybody's got that email and they're picking theirs up. Also, maybe just a comment too, just that, you know, with the people that are going to choose to do distance learning and with, you know, how fluid everything is, we're just going to want to stay aligned with our partners like at LCTN and different things like that, just to make sure that, you know, availability, reliability is there from an internet connectivity standpoint and different things like that, so that, you know, we can keep everybody engaged and keep learning happening.
Mm-hmm. Absolutely.
So next week, following our board meeting on Monday, we'll look at sending out some family-student communications. We've got some frequently asked questions documents ready to go. We've got some staff communications ready to go. So at least we can get some of this information out there. Hopefully people have been able to tune into this to answer some of their questions, or I'm hoping that we'll have this recorded so they could look at it at a later time. As mentioned at the beginning of our presentation, we have to stay adaptable, flexible, and we know this is going to be an ever-changing school year. And we look forward to working with our parents in a collaborative way to make this work. And we're going to do the best we can to keep people safe and in school if possible. So, Keith, I think that's all we have unless you have some additional questions for us. Tina, is that all we have? Yes.
I think just one more thing, Darren, if the board is having any questions that you feel should go on the frequently asked questions document, if there's some things that you've been seeing, send those to Darren or me, and we can make sure we're getting people's questions answered.
Certainly. Thank you.
Darren, Director Wilkie, one more time. I've been asked this question a few times, and I just want to make sure that I have the right information. I've been asked, is the school start date still the same?
The start date at this time is still the same. Something could change between now and then, but right now that's where we're at.
Thank you.
This is Joellen. I just want to thank the district leaders for the countless hours of hard work. I can't even imagine. I know how much I've been thinking about it, and it's not my full-time job. But I would like to also say that anyone, parents, staff, with questions or comments should get hold of us, contact us, board members, before Monday evening's meeting.
Yes, thank you.
Are there any other comments or questions? So no action on this topic is required until Monday. So this gives the board time over the weekend to consider. If you do have questions of administrators, I would encourage you to do that either yet today or on Monday before our meeting at 5:30. So if there are no further questions.
I would just like,
oh, go ahead.
I just wanted to make a comment that I appreciate you guys taking the time out of your day today. This has almost been a 2-hour commitment to get the information. And if, like you say, Keith, if you do have questions, certainly let us know prior to Monday and we'll do our best to answer them.
So.
And Darren, I appreciate you setting this up as well. I know this was really, really valuable, so I appreciate you doing it.
Yeah.
So, and to echo Joellen's comments, thank you to all of our administration for the time, you know, and the planning that they've put into this. This is, you know, all uncharted territory for schools. So thank you for your leadership. And yeah, so again, if people have questions, please, you know, seek out answers before we need to decide on Monday. If there are no other comments or questions, are we ready to adjourn?
Motion to adjourn.
Okay, motion to adjourn by Director Wilkie.
Coleman, second.
Director Beck.
Second by Director Bettenhausen. We will vote by roll call vote. I don't know if Tiffany is still with us. Director Bernard? If not, Director Bettenhausen?
Aye.
Director Camrath votes aye. Director Kimball?
Aye.
Director Kimball votes aye. Director Pullman?
Aye.
Director Pullman votes aye. And Director Wilkie?
Aye.
And Director Wilkie votes aye, and the motion to adjourn carries. Thank you all for meeting today. Have a good weekend. We'll see you on Monday.